Professor Hassan Zmerly is a distinguished Lebanese orthopedic surgeon, academic and researcher renowned for his expertise in sports traumatology, cartilage repair, and joint arthroscopy. He currently leads the first orthopedic division at Villa Urbosa Hospital, Gruppo San Donato, in Bologna, Italy. In addition to his clinical work, Professor Zmerly is an adjunct professor of orthopedics at the University of Bologna and professor at Semmelweis University, Switzerland, as well as other institutions, where he teaches orthopedics, anatomy, and regenerative medicine. His areas of expertise include sports traumatology, arthroscopy, cartilage restoration, joint replacement, periprosthetic joint infections, and orthopedic oncology. Professor Zmerly performed over 15,000 surgical procedures. He has published more than 120 peer-reviewed articles and is actively involved in international research and collaboration. Professor Zmerly serves on the Sport Traumatology and Arthroscopy Committee of SICOT, International Society of Orthopedic Surgery and Traumatology, and sits on editorial boards for several respected journals, including PLOS1. Professor Zmerly is widely recognized for his contributions to advancing orthopedic care, both in Italy and internationally.
It's an honor to welcome Professor Zmerly, who's going to speak about the latest techniques in cartilage repair.
مساء الخير للجميع وميرسي كتير على الدعوة وكونجراتوليشن عن جد على هالأورجانيزيشن تبع الميتينج. قبل كل شيء بس بدي أخبركم شغلتين عن جامعة بولونيا اللي هي أقدم جامعة بالعالم وكمان أحلى جامعة بالعالم. Cartilage lesions are very common injuries. Worldwide, there are 250 million people affected by cartilage injury. In our personal series, we found 64% of cartilage injury during knee arthroscopy, and the lesion was grade 4 in 13% of cases. Grade 4 cartilage injuries are injuries with exposure of subchondral bone. Here we can see the difference between the different grade of cartilage injury. In the image, we have a full thickness lesion, and here the partial thickness lesion. And the treatment of cartilage injuries is based on different factors. We have the grade of the lesion. Here we can see a normal cartilage, a softening cartilage, fissuration, and partial thickness and complete lesion. It is very important the dimension of the lesion, the number, the origin, if traumatic or degenerative lesion, the patient activity level, the presence of meniscus is very important, the knee stability. Some cases we can do ACL reconstruction with cartilage repair. It is very important the presence of axial deviation and the presence of osteoarthritis. بهالصورة منشوف الجريد تبع الاوستيوارثرايتس تبع الني. إذا في جريد 4 اوستيوارثرايتس هي معناتها حالة بدها ني ارثروبلاستي. نحن اليوم نحكي على كارتيلاج انجري إذا في جريد 1 جريد 2 وأوقات جريد 3 اوستيوارثرايتس. يعني الفرق بين الكارتيلاج انجري والاوستيوارثرايتس مثل إذا عندنا ملعب جول. إذا العشب تضرر بمنطقة معينة فينا أنا أجي أزرع العشب، بس إذا كل الملعب صار تراب ساعتها هيدي ني أوستيوارثرايتس. هون ما بيعود بفيد إن نعمل cartilage repair. Another important element is the distinction between chondral and osteochondral lesion. وهلا منشوفه بعدين. The available treatment for full thickness defect are bone marrow stimulation, autograft and allograft, biomaterial and cell-based therapy. وهلا بنحكي عن كل واحدة. Microfracture is the most used technique. It is a technique easy to do with low cost. With this technique, we can reach every area in the knee. The technique consists of creating a hole in subchondral bone to recruit the bone marrow from the subchondral bone and to create a superclot. This clot can transform the lesion in repair, but the problem is the tissue repair, because with microfracture we have not a hyaline cartilage, but a fibrocartilage tissue with bad quality biomechanically and over the time. The aim of regenerative medicine is to produce hyaline-like cartilage, and modern techniques are based on scaffold application that can be used with application of only the scaffold or with addition of cell. The rationale of using a scaffold is to have a temporary 3D biodegradable structure that fill the defect with the role of promoting the infiltration, the adhesion, proliferation, and differentiation of progenitor cells. The scaffold may be fabricated as a sponge, a foam, membrane, gel, or cylindric, and can be made from natural material or synthetic material, and can be for chondral lesion or multi-layer for osteochondral lesion. The scaffold can be used with cell or without cell. Autologous matrix-induced chondrogenesis is the most used technique among the cell-free scaffold. This technique combines the microfracture with scaffold. After doing microfracture, we can cover the lesion with membrane scaffold. The aim is to improve the mechanical stability of the clot and to provide a stimulus for chondrogenic differentiation. Here is the technique. With the chondropeak, we create the hole, and after we can implant the membrane that have to be fixed with fiber glue, suture, anchor, and other. Chondrocyte transplantation is the mainstay of cell-based therapy. So cell-based therapy are the therapy when we use the cells. The first use are the chondrocyte cells. With the technique of autologous chondrocyte implantation and matrix-assisted chondrocyte implantation, the cells are cultured in special laboratory to increase their number and reimplanted a few weeks later into the site of the cartilage defect. شو كنا نعمل؟ هيدا هالحكي من 1997 بهالفترة. كنا ناخد فراغمنت من الكارتيلاج من نون ويت بيرنج اريا، نبعته على اللابوراتوري، باللابوراتوري ياخدوا الكوندروسايت من الكارتيلاج، يعملوا له مولتيبليكيشن، يعملوا كلتشر، ونحن نعمل له بعدين امبلانتيشن. هو الاول حالات عملناهم، بالاول كانوا يبعثوا لنا الكلتشر ليكويد وكنا نحطه ونعمل له كوفر مع البيريوستيوم، بس كان يعطي مشاكل. بعدين صاروا يجوا مع الماتريكس اسيستد، يجوا الكوندروسايت الكلتشر اوف كوندروسايت على الممبرين، ونحن كنا نحطه نرجع محل الديفكت. But the problem is the two steps procedure. يعني بدنا نعمل له عمليتين للمريض، أول عملية وبعد شهرين العملية الثانية. يعني عنا high cost, long recovery time وفي كمان legal problem. لما نحن بدنا نعمل culture للسيل منفوت بقصص كبيرة وبدها يعني permission معينة يعني. Now the tendency is to use the one-step procedure with other cells and by changing the preparation of the chondrocyte. Now the technique are simply the cell can be obtained from the bone marrow aspirate concentrate. يعني بنعمل aspiration للبون ميرو، بنعمل له centrifugation والconcentrate بنحطه على الممبرين وبنعمل له نفس الحديث الامبلانتيشن. أو بنستعمل الاديبوس ديرايفد ميزانكيمال سترومال سيلز. بس كيف الاديبوس ديرايفد هو التيشو الابدومينال من الابدومينال تيشو بنعمل له هون هارفستنج، بنعمل له centrifugation وفلتريشن to obtain the vascular stromal fraction that contain mesenchymal multipotent stromal cells وبنرجع بنحطه على محل الليجن. بينما الوان ستيب autologous cartilage procedure اليوم عم نعمل هيك، بنشيل الكارتيلاج الفراجمنت تبع الكارتيلاج من النون ويت بيرنج اريا، بنعمل له فرانتوميشن، بنعمل له كاتنج، بنحصل على البرودكت اللي بنحطه مع محل الليجن. وكمان فينا نحصل عليه by from the lost bodies. In case of lost bodies فينا هالكارتيلاج lost body نعمل له نفس التريتمنت ونحطه محل الليجن. كل شوي بحكي بالعربي هيك حتى نفيقكم كمان. The indication of all technique with scaffold with cell is age from 16 to 55 years and in large size lesion. Generally in focal lesion, but in particular case we can do it also in kissing lesion or multiple lesion. Another important indication are the osteochondral lesions, the osteochondritis dissecans, and the secondary osteonecrosis. هيدي حالة secondary osteonecrosis. نحن مثل ما بنعرف السكندري osteonecrosis هو osteonecrosis بالني، بيجي secondary other disease وبيجي عند young people. هيدي بنت عمرها 22 سنة وهون عملنا لها drilling لأن الليجن هي deeps drilling و application of multi-layer scaffold. بالاوستيوكوندرايتس dissecans كمان إذا في complete defect فينا نعمل treatment. بس بالاوستيوكوندرايتس dissecans الpriority is to fix the fragment to find the fragment and to fix it. Generally an osteochondral fragment. In some cases we have only a chondral fragment and in young people مثل هالحالة عملنا fixation only the cartilage fragment without bone. هيدا كان عمره 15 سنة. When we analyze literature results, we found that microfracture can give satisfactory results in 65-70% of cases with the correct indication. In our precedent series, in lesion less than 2 centimeters in the medial femoral condyle, with no important axial deviation, with the presence of a normal meniscus, the lesion can reach 83% of satisfactory results. The studies that compare AMIC technique and microfracture show a higher results for AMIC technique at 5 years, a better feeling of the defect, and a highly like tissue in the histologic study. With the adjunct of cells, we can reach more than 90% of good results, even at medium and long-term follow-up. Also, the single-stage autologous cartilage repair, this is a new technique, the one stage, the single stage, but the results are promising. All the studies that compare this technique with scaffold, with cell or without cell, show a similar results at short and medium term. But the technique with cell-based procedure continue to improve over the year and are maintained over time. Also in football player, in a recent systematic review, when we have the correct indication with the different technique, we have similar results. Here, our study of case of osteochondritis, this second and fourth grade cartilage. So in conclusion, the advantage of matrix-associated microfractures technique combines those of microfractures with those of matrix. The progenitor cells stay in place and help to produce a new tissue with characteristic closer to the cartilaginous one. هيدي حالة بالكاحل نفس السيستم microfracture وapplication لممbrane. Scaffold are considered not only a transport system, but also have intrinsic characteristics to promote the self-regeneration of the body. The association of other cell SARS and growth factor can represent an improvement of the technique itself. However, further evidence are needed before more definitive conclusion. يعني بالنهاية نحن عنا المريض اللي معه كارتيلاج ليجن ما معه أرتروزي ما معه سيفير أرتروزي اللي معه أرتروز قليلة يعني الإيرلي أوستيوارترايتس هيدا بنعمل له conservative treatment. في كارتيلاج ليجن grade 4 عنا different technique لازم نستعملهم with the correct indication to avoid the progression of the disease to the stage of knee arthroplasty. Thank you.